Hello, peeps, and welcome to another episode of the Prescription for Better Living podcast, where we discuss all things health and wellness in a hip and relatable way. I'm Dr. Hernando Carter, your board certified internal medicine physician. Yes, your primary care extraordinaire. And welcome to episode 26 of the Prescription for Better Living podcast. Thank you so much for joining us. Thank you so much for your support, your continued viewership. And you know what I need you to do? I need you to, if you have not already, subscribe to the YouTube channel. I need you to like and comment on the video, share the video, stand on the tallest mountaintop and scream. You know what I'm going to say. Hallelujah. Dr. Carter is here. If you would like to continue to support the work that we're doing with this podcast, there are a couple of ways that you can do that. You can subscribe to our Patreon channel. You see the QR code and you see the address there. It's patreon.com/Dr. Hernando Carter, all one word. Also, do you have a small business? Do you have an event coming up that you like to promote? Or if you just like to have a shout out, you can be an episode sponsor. And you can email us at contact@rxforbetterliving.org. That's contact@rx, the number 4, betterliving.org. And we will get back with you. So again, this is episode 26. And you know, on episode 25, we started talking about something called the social determinants of health. And more specifically, we got into talking about food deserts. And I won't give a full recap of episode 25 because I want you to go back and watch it, but it was about food deserts. But I thought today we would take time to just really kind of lay out what a social determinant of health really is, especially because we're going to spend the next several episodes kind of breaking down these social determinants of health individually. We're also going to get into this practice of redlining. And you say, what does all that have to do with what you're talking about, Dr. Carter? I thought you said you're a primary care doctor. I thought you said you were talking about all things health and wellness. So what does this have to do? What does social determinants of health? What does redlining? What does all that stuff have to do with health and wellness? And I'm glad you asked. Remember, again, I'm going to keep bringing this up, how we talked about just health disparities, right? And how we talked about how people of color fare worse in terms of health outcomes compared to their white counterparts. And I asked the very ridiculous question of, is it just bad luck to be Black as it relates to health? And the answer is, of course not. So then how do we explain health inequity and health disparities? And these are the things that we're talking about on this podcast, trying to pull back the veil so that you can know and understand that we don't live in boxes, right? And so everything that we experience, everywhere that we go, etc., it all has an impact on our health. And so this is what things like food deserts and lack of internet access and voting and being active in the political process, all these things have interplay with health and wellness. So let's get into what the social determinants of health are and what is a definition of a social determinant of health. I am a member of the American College of Physicians, or ACP for short. And the American College of Physicians is a national organization comprised of internal medicine doctors. So people who have gone to internal medicine residency, and it can be people who did general internal medicine like me, or a lot of your subspecialists, they did a general internal medicine residency first, and then they went on to fellowship to subspecialize. Those physicians would be your cardiologist, your gastroenterologist or GI doctors, your lung doctors, which are pulmonologists, endocrinologist, a lot of the ologists, okay? So, American College of Physicians is an organization comprised of internal medicine doctors, also medical students and residents who are interested in that pipeline or that track to internal medicine. And American College of Physicians has um, a lot of different, arms, right? Uh, the academic arm, where we focus on educating and focusing on continuing medical education for students, residents, and physicians. Also, there is a public policy aspect where the American College of Physicians will weigh in on health policy and health issues in our country. I can say that I'm proud to be a member of the American College of Physicians, and I've been so for, my goodness, I can't think how long. I am a fellow of the American College of Physicians, and I will say that as it relates to just an academic group, but just a group of serious minded clinicians, I'm very proud to be a part of it. I'm not speaking on behalf of the American College of Physicians. All of this is my opinion, but I am going to reference a position paper that was released by the American College of Physicians in a publication known as the Annals of Internal Medicine, which is one of the medical journals that is produced by the American College of Physicians. So, this position paper was approved by the Board of Regents of the American College of Physicians in 2017, and it was published in the Annals of Internal Medicine in 2018. And the title of this position paper is Addressing Social Determinants to Improve Patient Care and Promote Health Equity, an American College of Physicians position paper. So, plainly speaking, this paper was written about the social determinants of health, acknowledging the problem and acknowledging the underlying contribution that the social determinants of health play on health equity, right? So, a social determinant of health, as defined here in the position paper, is defined as the conditions in which people are born, grow, work, live, age, and the wider set of forces and systems shaping the conditions of daily life. They are responsible for most health inequalities. Social determinants are primarily rooted in resource allocation, resource allocation, and affect factors at the local, national, and global levels. So, broadly speaking, the social determinants of health are our environment. So, for us, what is comprised of our social determinants of health comes from what happens in this country, in the United States, in the state in which we live, county down to the city level, down to our neighborhood. The paper then goes on to say that they gathered evidence over the past 30 years prior to the publishing of this paper, and that evidence supports the substantial effect of non-medical factors on overall physical and mental health. 30 years of evidence supports the substantial effect of non-medical factors. Non-medical factors. Non-medical factors on our physical and mental health. So when people tell healthcare workers, doctors, nurse practitioners, physician assistants, nurses, physical therapists, dentists, optometrists, anyone involved in delivering care in the medical industrial complex, they tell us to stay in our lane. The evidence shows that our lane is any and everything that impacts our lives. 30 years of evidence show that non-medical factors play a significant role in our physical and mental health. An analysis of studies measuring adult deaths attributable to social factors found that in the year 2000, approximately 245,000 deaths were attributable to low education. 176,000 deaths were attributable due to racial segregation. 162,000 deaths were attributable due to low social support. 133,000 deaths were due to individual level poverty. 119,000 deaths were attributable due to low social support. And that number was similar to the number of people who died of lung cancer in that same year. So people died of low social support at the same rate in that year that others died of lung cancer. Social determinants of health. The United States, despite ranking among the 10 richest countries in the world per capita, experiences sizable health disparities among its citizens that are rooted in social, economic, and environmental factors. In the United States, place of birth is more strongly associated with life expectancy than race or genetics. I'm going to read that again. The United States, despite ranking among the 10 richest countries in the world per capita, experiences sizable health disparities among its citizens that are rooted in social, economic, and environmental factors. In the United States, place of birth is more strongly associated with life expectancy than race or genetics. For my Birmingham folks, you know what I'm about to say. What this means that if you are born and are reared and live in zip code 35211, we can extrapolate that your life expectancy is going to be shorter than someone who was born and reared and lives in zip code 35208, 35242, 35216, because those are the more affluent areas. That's where the resources are. That's where there's less pollution. That's where there's more access to good grocery stores. On average, there is a 15-year difference in life expectancy between the most advantaged and disadvantaged citizens. 15 years. Do you remember when I told you several episodes back that this is where Dr. King was going after the passage and the signing of the Civil Rights Act? He was not done. He was not done. He was going to move to social and economic justice. And this is why. Because you can have the right to vote. You can get rid of Jim Crow. You can marry a black person or a white person. All of that. But if there is no economic justice, if there is no social justice, you still die sooner. And what kind of world is that? What kind of country is that? So I'm going to talk to my providers out there, my providers of healthcare, doctors, nurse practitioners, physician assistants, nurses, physical therapists, dentists, optometrists. Listen, if you have patients that are ill, that are complex, that have conditions that are difficult to handle and manage, and they are from a disadvantaged socioeconomic background, if we're not doing something to try to impact that social and economic status for our patients, we're pissing in the wind. And if you view that patient's failure to achieve the better blood pressure or the better blood sugar or what have you as simply that individual patient's failure and not our failure collectively as a medical industrial complex, not our failure collectively as citizens of this country, not our failure collectively as human beings, then you are way off base. Because we all have a role to play in this. Black, white, yellow, brown, all of us. Let's stop letting people divide us with these culture wars. Because what I read this paper to say, that a poor white person is just as likely to die early as a poor black person. And your white skin alone does not make you immune to premature death and morbidity on your life. It does not. It just so happens, however, that systemically, things are not only put in place to limit or put a ceiling on how high people that look like me can go. It also happens that the system exists to be more likely to take things away from people that look like me. Think about the farmers. Black farmers sued for discrimination because they were not given the same level of support as white farmers from the USDA. And they won. Black farmers are owed billions of dollars. But they ain't getting paid. Senators and representatives tried to pass the farm bill to address that. And white farmers protested. And black farmers lost. We know all that stuff happens, but scientifically, from a epidemiologic standpoint, This study shows that where you're born and where you're reared shortens your life, whether you're black, white, yellow, or brown, or red. So let's lay out some of the social determinants of health topics that we're going to talk about in the upcoming weeks, and then I'm out your hair. Socioeconomic status is a social determinant of health. We're going to get into socioeconomic status. Housing is a social determinant of health. That's why we're going to get into redlining. We already talked about Superfund sites. We already talked about food deserts. That falls under the umbrella of housing. Transportation is a social determinant of health. Food and agriculture is a social determinant of health. I want you to remember this term, the digital divide. Yes, access to Wi-Fi, broadband, is a social determinant of health. Racial and ethnic health disparities is a social determinant of health. So, this is a very complex topic, y'all. It's heavy, it's deep, just like all of these have been. But there are not enough people talking about this. And those voices that are talking about it are not being amplified to the level that they should. And we are going to stay on this battlefield. Come hell or high water. We're going to stay on the battlefield, y'all. So, this has been another episode of the Prescription for Better Living podcast. Believe it or not, I am Dr. Hernando Carter. Yes, I got those credentials, even though I don't act like it sometimes. Board certified, oh yes, even though I don't act like it sometimes. Internal medicine physician. I am still your primary care extraordinaire. Saying, remember to subscribe to the YouTube channel, like, comment on the video, share it everywhere you go. Scream to the top of your lungs. Hallelujah. Dr. Carter is here. And until next time, unless they kick me off of Elon Musk's internet, I'll be here. Dr. Carter, out.